surgery questions, and I am happy to answer it. And remember, you're getting good information. It's coming from a double board certified, Ivy League educated, Duke trained plastic surgeon with over 12 years of experience and thousands of cases under my belt. So I am happy to answer any question that you may have regarding plastic surgery from head to toe, okay? But before we get into that, today I just want to just briefly talk about a new procedure that we have here at Pure Plastic Surgery. I did a case yesterday and it went really, really well, so I'm super excited about it now. And I want you guys to just learn a little bit more about what it is, because when you first talk about it, it can sound scary, and I get that, okay? So what I'm talking about here is this new procedure called the rib remodel procedure. Some people have different names for it. Some people call it bee waist, as like a Barbie waist. Some people call it wasp waist. And there are other terms for it right now, but really the official term for it is rib remodel. And what we're talking about here is actually changing the shape of the ribs so that you can achieve a smaller waist, okay? And this is for people where they have the ribs, especially the lower ribs, where they're a bit too flared out. And because those ribs are flared out, it's very difficult to cinch in that waist. And so they even after liposuction or other procedures, they still end up looking fairly straight, fairly boxy. And so this is the way to really take body contouring to the next level. This is the final frontier, right? So right now we're not just talking about skin, we're not just talking about fat, we're actually talking about reshaping and remodeling the bony rib structure, okay? And so that's what it's all about. And so typically when I start to talk about this, the first thing people say are like, oh my God, doc, are you crazy? Or is that patient crazy? Or whoever's crazy, why would they be doing something crazy like this? It's crazy to me that they're gonna be touching their ribs, right? And the reason for that is because there's the old school thinking that rib remodel means that we're removing ribs. And that's the first thing that I want all of you to know. It is not rib removal, okay? We are not taking out ribs. Ribs are not being removed, okay? And there are no big incisions, and it's not like a super invasive procedure. That's actually where the new technology for this procedure comes in. So the ribs are left in your body, okay? There are no ribs leaving your body. That's the first thing I want everybody to know. All right, and it's done in a way that it's done through a very tiny incision in a minimally invasive way, which is what makes it very, very safe, okay? And those of you that know me know that safety is our #1 priority here at Pure Plastic Surgery. And if this procedure was not safe, I would not be doing it, right? You guys know that. That's all I talk about. I've been talking about it for the last 7 years. With BBLs, I was one of the first to use ultrasound guided imaging for BBL to make that procedure safe. And so now for this procedure, I have done all the research, I've done all the training, and I know that it can be done very, very safely here in the outpatient surgery setting. And that's why I brought it here to Pure Plastic Surgery, okay? So first thing you want to know, it is not rib removal, okay? It is a very safe procedure. We are basically just changing the shape of the ribs, but we're not taking out the ribs, okay? And what ribs are we talking about? We're only talking about the lower ribs, which sometimes we call the floating ribs. That's the other part that makes it safe, right? We're not talking about all the ribs, and we're not even talking about the upper ribs. We're talking about only what's called the floating ribs, which are the lowermost ribs, which are the ones that if you do shape will bring in the waist. But these ribs are safe to reshape or remodel because what they don't have is what we call the technical term a neurovascular bundle, meaning they don't have arteries, veins, and nerves attached to them, okay? And so what are those ribs? It's ribs 10, 11, and 12. It's not gonna be 10, 11, and 12 for all people. About 50% of the population has 3 floating ribs, 10, 11, and 12. The other 50% only has 2 floating ribs, 11 and 12, okay? And so the ones that we're gonna remodel are the floating ones. And so how can you tell if it's about 50-50? Well, the way to tell is that we need to do some prep work. And that prep work means ideally we would do a CT scan of the chest with a 3D rib reconstruction. So we're able to do that CT scan of the chest before your surgery. They can do the 3D rib reconstruction, and then I can take a look at it. I can make sure I can take a look at the ribs. It's going to give me a lot of information. For example, it's going to tell me, do you have 3 floating ribs or you only have 2? And it's also going to tell me what is the size of rib 12. Because in some people, that rib can be a significant rib that actually needs to be remodeled. But there are some people where that rib 12 is just like this little tiny nubbin of a rib that nothing needs to be done. It's already a little tiny rib, okay? So this is going to be very important. I'm going to ask for this for all of our patients that we do rib remodel moving forward, okay? And hopefully it's something that you'll be able to do before you have your surgery. Now, if we're not able to do this for whatever reason, like I said, this is my first choice, right? First choice. If we're not able to do that, then of course I can take a look at everything with the ultrasound while you're here, and that's another possibility. But really, this would be the best thing in terms of prep, is to be able to get this CT scan before surgery. Okay. Now, what is the innovation? The innovation is that this can all be done with a specialized tool that's called a piezotome. Okay. And it can be done through a very tiny needle hole. So no big incision. We're not even talking an incision the size of a liposuction cannula incision. Okay, this is even smaller than that. This is a little tiny incision that we are using with we're using an 18 gauge needle to make that little tiny needle hole. With the 18 gauge needle, we then go down, we identify the rib. We can use that needle to then clean off the rib. We have to remove a layer that's called the periosteum. And so with that needle, we clean off the rib basically. And then after that, we can follow through with the piezotome device, which is in the shape pretty much of an 18 gauge needle. And what is that device? Well, that device uses like an ultrasonic type of energy as well. And what that helps do is that it's able to basically address only bone. So it addresses only bone, and it does not address the other tissues that are around the bone. So it doesn't really cut into like muscles or nerves or anything else, right? And so it's a very specialized device, and it can affect just the bone. So we just cut through the bone of the rib, and we're not even cutting through the rib entirely. This is the other new advance. We're able to cut only through the upper part of the rib, okay? So think about the rib. The rib has two kind of cortices, is the actual term. Has the upper one and the lower one. And so we're only cutting through the upper cortex and not the deeper cortex. So it's not even a full fracture of the rib. It's what we call a green stick fracture. Okay? It's a green stick fracture because what that allows us to do, think of it as the rib is kind of straight like that, and we want to make it a sharper angle. So we're just going through the upper cortex so that we can just simply bend the rib in an angle like this and then allow it to heal in that new position. And so we're not completely fracturing the rib. The lower cortex remains intact. And so then for the rib can then just bend into a new position and then heal into that new position. And this is what's called, if you want to look it up, it's what's called a green stick fracture. Okay? And so if you have these ribs that are flared out, you can create that green stick fracture, and so then you can bring the rib in, okay, to create a smaller circumference, therefore a smaller waist. And that's how this procedure works. And because of the fact that it's not even a full fracture, because of the fact that we're doing it through a tiny 18 gauge needle hole, okay, there is no increased pain due to this procedure. And also the fact that we're only doing it to the floating ribs, which theoretically or typically don't have a neurovascular bundle, so they don't have nerves. So because they don't have nerves, because we're doing it through a tiny hole, and because it's not a full fracture, you're not going to have increased pain. That's the other innovation here, okay? But we do, of course, need this to heal. And so how do we set it into place, into its new position, and allow it to heal in its new position? Well, the way that we do that is is externally by the use of a corset. So yeah, quite literally a corset, okay? Like the ladies used to wear back in the, what was it, 15 or 1600s? That's what we're talking about. We're gonna be using a corset. And you have to be able to use this corset for 3 months. And this is key. This is key. All right, if you're not going to make that commitment, don't do the procedure. You have to commit to wearing a corset for 3 months okay, so that the bone can heal in the new position and there's no issues of it not healing, what's called a non-union or malunion or things of that nature. So you have to commit to wearing that corset for the first 3 months, okay? A lot of the most, I'm sure there's a bunch of questions out there, but I'm just gonna go ahead and answer one, which I'm sure there is like, what can I combine this with? You can combine it with pretty much any procedure. We can combine it with, for example, a tummy tuck. We can combine it with a lipo 360 or BBL, or of course a breast procedure, okay? And then the other question is gonna be like, who is the best candidate, right? Well, everything that we do, not everyone's a candidate, right? So in order to be a candidate for this, you want to be under 40 years of age, okay? And you're going to want to be lower on the BMI scale, typically a BMI of like 24 or below, okay? Because I have to be able to reach the ribs, right? There's a whole bunch of fat or other tissues on top of the ribs and I can't reach and we can't do this procedure, right? So if your BMI is too high, we can't reach the procedure. But also, if your BMI is too high, you're going to get a big result with liposuction alone. You don't need to add this to it. But this is typically for our lower BMI patients, right? So if your BMI is 24 or below, it is also in those patients where we have difficulty creating more of a curve, right? Because there's only so much fat that we can remove. And so if you want to be more curvy with a lower BMI, then this may be a good option for you so that we can really shrink that waist down, bringing out more of that hourglass shape. Okay? All right. So that was very brief, but I think a lot of information. I hope you're able to soak that in, and I'm happy to answer any questions about this or any other plastic surgery questions you may have.
Yes, a lot of questions. First about the rib remodel.
Yeah.
What's the pain like, and when can I get back to my daily routines, working out, going to work, etc.?
Well, okay, so daily routines and working out is going to be different. But the pain, like I said, there's really no increased pain, not increased to whatever procedure you had. So for example, if you had a lipo 360 BBL, the pain is going to be similar whether you do the rib remodel or you don't. So you're going to have the same pain of the original procedure that you're having, okay? Now, like I said, we need this bone to heal. So you have to wear the corset for 3 months, and you're not going to be working out for 3 months, okay? So you're not going to the gym for 3 months. Again, there is a commitment to this after surgery. You have to make sure that you're able to commit. Having said that, going back to like office type settings, driving a car, daily activities, all that is going to really depend more on the primary procedure. So like a 360 BBL, you're typically back to doing that within 7 to 10 days. If it's a tummy tuck, of course it takes longer. It's going to be about 3 weeks, okay?
Thank you. Hi, doctor. I did a BBL 6 months ago. I want a smaller figure and shape. Can you do reduction?
To reduce the BBL? Yes, certainly. So that is something that we do here. Not everyone does that because these can be challenging procedures, but I do offer BBL reduction, BBL reshaping as well. And so that is certainly something that we can do. However, if you had your BBL only, I think you said 6 months ago, I would wait a little bit longer. You probably want to wait at minimum 9 months, ideally a year, before then going back and then trying to reduce everything and reshape everything.
Yep, she said 6 months.
Yeah.
Next question. Hi, I'm 10 weeks post-op my mommy makeover. When would it be safe to start ab workouts and arm workouts with light weight?
Okay, so if you're 10 weeks out, actually you're pretty safe already. So typically I say you can start heading back to the gym at around 6 weeks. Starting off lightly in the gym, usually by about 8 weeks, you're pretty much back to all your regular, regular gym activities, including ab workouts. By 10 weeks, though, you should be okay. You should be able to head back to the gym, do core, abs, etc.
Hi, doctor. I'm looking to get surgery soon. What's the difference between cosmetic surgeon and plastic surgeon?
So there is actually a pretty big difference in terms of education, training, testing, etc., etc., etc. Okay? So a plastic surgeon that is board certified by the American Board of Plastic Surgery is someone who actually had very specific training in plastic surgery, both in aesthetic plastic surgery and reconstructive plastic surgery. This is someone who did either a full 6-year plastic surgery program or who did, first something like the way I did it. I did 5 years of general surgery and then 3 years of plastic surgery. So imagine that, 8 years of training to do this. And then on top of that, I had to take several written exams and then oral exams. And once I passed all of that is when, oh, not only that, and then an evaluation of my first 50 cases. And once I passed all of that, then I was able to become board certified in plastic surgery. So I am double board certified in general surgery and plastic surgery. A cosmetic surgeon is someone who did, something else. Could be general surgery, can be OBGYN, could be anything, and then basically did a cosmetic fellowship. Basically, they followed someone for a year after that, and then that was it, right? The Board of Cosmetic Surgery is not a true board in the sense that it's not accepted by the American Board of Medical Specialties, so it is not accepted by that, so it is not a true board.
Thank you very much. Does alloclay in the breast affect the result of mammograms in the future?
I mean, could it show something a little bit different? It could potentially in the same way that fat grafting to the breast can show, right? So that is something that you need to let your doctors know, something that you need to let the mammographer know, because they could potentially see that in the same way that they would see like fat being added to an area. But other than that, it doesn't really affect you in terms of, your surveillance and then, checking for breast cancer or anything of that nature.
This is a follow-up question to your BBL reduction. I know that you perform BBL reduction. Is lipo possible to do that, and will it leave it lumpy, or can it still provide a smaller, smooth result?
So it's a good question. So the way we do it is with liposuction, right? That is a way to reduce, and so we have to remove, any excess fat that's there, and I try to do it in the smoothest way possible. Sometimes adding some Vaser does help. So doing the Vaser first and then the liposuction can help remove the fat in a smoother way. But the other consideration that needs to be taken is that, especially if you're starting with very, very big hips or very, very big buttock, is the skin factor, right? Because if that skin's been stretched out, you want to be able to have that skin retract back down. So a lot of times, if it's going to be a significant reduction, we have to add some skin tightening to it, which can be done with our devices such as J-Plasma or BodyTite.
Thank you. If I have stage 1 or 2 capsular contraction on one implant, could I live with it? I have no pain.
Yeah, so, stage 1 is a normal breast. Stage 2 is very mild. So if you have a stage 2 and you have no pain and it doesn't get any worse and you're living with it, then there's really no need for you to rush and do anything. There's nothing that you have to do. You can continue making sure you stay active. You continue massaging the area. I would recommend that. So continue massaging the breast on a daily basis. Just make sure it doesn't get any worse. But if it stops there, then you're okay to just go on with your normal life.
How many times can one person get lipo in the same area?
Well, the most that I really want to do comfortably would be about 3 times. Once you start getting past that, it can get very, very scarred down. The risks start to increase quite significantly. So obviously, the first time is what we like the best, right? There's no scar tissue there, so first time's the best. Second time is usually, for the most part, okay. Third time already becomes quite challenging, and like anything after that, it's just you got to be very, very careful.
Mommy makeover and rib remodeling, can that happen at the same time?
Yes, potentially that can be combined as well. So you can add some of the rib remodeling to the mommy makeover, which typically includes a tummy tuck and a breast procedure.
Would you recommend fat transfer to the hip dips along with rib remodeling?
Sure, that is definitely actually a good way to bring out that shape, right? So say for example, you're a lower BMI patient, say your BMI is like 22 or so, and in these particular patients, it is difficult to fully bring out that that hourglass shape because the waist can only be can only shrink so much, right? And so yeah, we can do lipo 360. We can get as much fat as we can. We can concentrate on transferring that fat to the hip area, and then we can bring the waist in with the rib remodel procedure, and that's going to bring out more of a curvy shape.
This refers to rib remodeling. Do we know of any long-term side effects to this procedure?
So far, the long-term side effects of, say, like a non-union, meaning that it doesn't heal, that is a possibility, but the percentage is very, very low. We're talking like in the 1% range. And typically that's because a patient is non-compliant, okay? Like I said, like this is a non-negotiable. If you're gonna do this procedure, you have to be neck set for the first 3 months. And if you're not willing or unable to do that, then don't do the procedure.
Thank you. I just got rib remodeling procedure done. When is it safe to get pregnant?
To get pregnant? Why are you gonna do that already? Okay. So we want, well, you just need the rib to be fully healed, so probably any time after 3 months.
And a follow-up question to that, she says, would I need surgery again? Would it affect?
Yeah, that's what pregnancy does. That's why sometimes we need to do, well, not need, but our patients want to do this, because when you become pregnant, right, as the baby grows, it does, of course, push the belly that way. We all know that, but it also pushes up. And when it pushes up, it pushes those ribs and those lower ribs that we're talking about. And so that's why you may have noticed that your waist is wider after pregnancy than it was before pregnancy, even if you weigh the same. Even if you lost all the baby weight and you're working out and everything else, you may still have a wider waist because those ribs have been flared out with the pregnancy.
Hi, doctor. In April, I went for a BBL with a different doctor, but my stomach looks as if I'm pregnant. What do I need to do?
Well, first of all, we have to determine what is the cause for that, right? And is the cause that you have still excess fat, like above the muscle, or is the cause the muscles themselves? Are the muscles separated or weak? Okay? So if the cause is the muscle themselves, you have muscle separation or weakness of the muscle, well then your best bet is going to be to undergo a tummy tuck with a muscle repair. Now, if the cause is that you still have quite a bit of fat overlying the muscle, then repeat liposuction should take care of that.
Can you explain what dog ears means after surgery, and if this can be corrected with the revision lipo 360?
So a dog ear is typically involved a surgery where you're cutting skin out, okay? So the most common area where we see dog ears sometimes is after tummy tucks, and you see them towards the end of the incision. And what it is, it's just a little excess skin in the area that causes the skin to kind of pooch out or roll over and kind of looks like an ear, and that's why we call it a dog ear, okay? It's usually not a big deal. A lot of times this can be fixed. A lot of times this can be fixed under local anesthetic. So you just basically inject the area, you numb it up, and you remove a little bit more skin, and then you're done. And it's usually something that just can be done kind of in the clinic setting, and very easy. You're in, you're out, and that's it.
Thank you. All right, I know you have to go to a meeting soon. A few more questions. How safe is tummy
Always
tuck?
another meeting.
Yes. Let me see. How safe is a tummy tuck, and do you recommend tummy tuck first or BBL first?
So a tummy tuck is a very, very common procedure, very, very safe if, like always my caveat, right? If you go to the right surgeon in the right place, okay, it can be very, very safe. And it's my preference, and I think it's actually the best results long-term to always do your tummy tuck first. So I recommend coming in, doing the tummy tuck, fixing the muscles, get rid of the excess skin, and then you can come back three months later or anytime after that to do your lipo 360 BBL.
Based on patients before body type, are you able to give a fairly accurate picture of what they would look like after lipo, tummy tuck, BBL, etc.?
So there are surgeons out there that have certain devices, and I think maybe nowadays sometimes they use AI. I don't like to do that because I don't like to overpromise, and I think a lot of these devices they do that. They tend to be not completely realistic. So I think it's more of a conversation. I like to have a conversation with my patients and what I think it can and cannot be achieved. And that's really the most important thing, trying to make sure that everyone has realistic expectations before undergoing an aesthetic procedure. Maybe as things develop, and AI is developing every single day, faster and faster and faster, maybe they can make them in a way where it is a lot more realistic, and so that the after that is shown by the AI is something that's quite realistic. And then perhaps if they do develop that technology, which may come soon, then I may incorporate it into pure plastic surgery here. But as of right now, I haven't seen anything like that, nothing that I'm completely satisfied with, so we don't use that technology.
Thank you. And last question. about, so you said you have to wear the corset for 3 months. The question is, do you have to wear it 24 hours a day, 7 days a week?
Pretty much, that's right.
Okay.
It's a commitment, okay? So you gotta wear it night and day for those 3 months. You can't stop.
All right,
Okay?
thank you.
All right, so that's it. We are done.
All set.
Man, that went by quick. Awesome, awesome. All right, everybody. Well, I hope you enjoyed this hump day. I do this every single Wednesday, typically somewhere around 4, it can be 3:30, 4:30 p.m. But if there's any specific topic that you guys want me to cover, please let us know. You can write to us there through our social media. You can send us a DM. Let us know what you want me to talk about, and I'm happy to do it next time, okay? I look forward to seeing everybody next week on Hump Day with Dr. Alex Rowe. Ciao.